This is Vanessa McElroy. This is about our third attempt to try this. Having technical difficulties. I'm trying to record my last module for health assessment class. This part of it is going to include abdomen, neurological, and then musculoskeletal. And then I'm going to try to do another one with heart and lungs on it because the length seems to be so great. I'm going to expose. I've already introduce myself, talk to Mr. McElroy. He knows what we're about to do. I'm going to be explaining as I go along. So I'm doing abdomen. I first want to inspect the abdomen. That's the first thing you want to do in anything, and it's of good color, it's warm, it's dry, pink. There's nothing seems that abnormal other than some scars, which I know are from previous surgeries he's told me he had. And then I'm going to grab my stethoscope too. I want him to raise his head, hold his head up for just a second. Okay, now you can lower it. And that was just to see if any masses or bulges appeared that weren't there before, and they didn't. So that's good. Then I'm going to take my stethoscope. I'm going to listen in all 4 quadrants of his abdomen for bowel sounds. And he definitely has good bowel sounds, and I would usually listen to him, time them a little more than that, and they should be somewhere between 4 or 5 to 30 a minute, and I'm pretty sure his are. The next thing I want to do is listen to the pulses, listen over the pulse areas to see if there's any bruise or any problems like that. And I'm going to do this with first the diaphragm of my stethoscope and then the bell. And I'm going at the abdominal aortic area right before it branches off. Then down to the next level on each side, which is the renal, where the renal arteries branch off. Then down to the iliac. And then all the way down to the femoral. If I had him disrobed a little more, I could go a little further down on the femoral. Then I'm going to turn my stethoscope, do the same thing, and listen with the bell of my stethoscope to all of those areas, just to make sure, and everything seems okay there. The next thing I want to do is we've already inspected and auscultated. Now we want to percuss, so I'm just going to lightly percuss in all 4 quadrants. I can tell where most of the tympanic sounds are up in this area. Then I want to palpate around the liver area and try to figure out his liver border, which I had done previously, and I've made some ink pen marks. What I did was percuss under the rib cage at the liver area to mark the borders of the liver, and I took an ink pen and marked that. When I find that edge, then I want to move up to the 10th intercostal space at the ribs, between the ribs, and percuss there till I find the edge of it. I've marked it with an ink pen. Then I want to measure that area. That's his liver span. That should be somewhere between 4 to 7 centimeters, and his is. Then we've gotten down to now to where we need to palpate. And I'm going to start with light palpation, just with one hand, lightly palpating all 4 quadrants. And in the middle too, especially over the aorta area, or any bulges or problems there. And I'm also, while I'm doing this, checking for tenderness, rigidity, any kind of muscle tension. Do you have any? Is that bothering you any? Then I want to move on to deep palpation and see if we can palpate liver. With some people, maybe his liver is not enlarged that I know of or that we can palpate. You want to palpate over all of the stomach systematically, feeling for any masses, bulges, ridges, and using your fingers to roll across anything that you feel to see if it's stationary or if it will move. And everything seems to be okay. You could also try to palpate the spleen, which is difficult to do in most people. I can have him take a deep breath and hold it, and I can feel the liver move up some. Now let it out. She'll breathe normal. The other thing I want to do is elicit a fluid wave. So if you put your hand here kind of in the center of your stomach, down this way a little bit, I can elicit a fluid wave on one side to see if it goes all the way across or not. Okay, that's just another way to check for ascites. Good. Then we want to check the shifting level of dullness. We want to percuss over his stomach, find out where the tympanic areas are, the high-pitched sounds, and where the dullness is, which is on the sides of his abdomen. And then we want to have him move to his side. And in a normal, healthy person, the side should have the tympanic sounds now because the air has moved up. But if we had a lot of ascites fluid or a mass or anything, then that wouldn't be that way. Okay, you can go back. So that feels normal. And then if you want to sit up, the other thing I want to do is in the CVA area right now here, check for tenderness by just putting my hand in that area and doing a little punch to see if there's any tenderness in that area. And is there? Okay. Now you can pull your legs this way. Now, that concludes the abdominal assessment, and we're going to move on to the neurological assessment. In that, we're supposed to be testing cranial nerves. You think I should touch it? And several of those we've already covered in our other videos, so I'm not going to go over those again, but I'll mention them. And I don't think I got me any better, did I? The first one, though, is olfactory. Cranial nerve 1's olfactory, and we haven't done that. So I'm going to test him for that by telling him to shut his eyes. I'm going to occlude one nostril, let him smell, see if he can identify the smell.
Vanilla.
Yep. And then I'm going to occlude the other side, see if he can smell that.
I think that's menthol.
Yes, the menthol. And then try one more scent just to see.
Apple.
Yeah. So he did those fine in both nostrils. We tested them individually and then together. The optic nerve, which is eyes, we covered in our eyes, ears, nose, and throat modules. The 3, 4, and 6, which is oculomotor, trochlear, and abducens, we've already covered. We haven't done trigeminal, so I want you to clench your teeth together real tight. And I'm just going to palpate. Anything tender there? Okay. And then we're also going to do, make sure he has good feeling. Can you feel that? Okay, the cotton. And as far as sensation of something soft in his forehead, cheeks, and chin, which we're going to have a problem with. Then we want to do sharp, something sharp. Close your eyes for me and tell me where that, if that's sharp or dull.
Sharp.
Okay.
Sharp.
No, where's my dull? Okay. Sharp or dull?
Dull.
Okay. And then
Dull. Sharp.
okay.
Sharp. Dull.
Dull or sharp?
Dull.
Okay, you got all those right. Then next is the facial. So for the facial, I'm going to ask him to do several things. One is raise your eyebrows up. Okay, that looks okay. Then squeeze your eyes shut real tight. I'm so afraid to touch it. Squeeze your eyes shut real tight. Okay, that looks good. Everything looks even when he does that. Wrinkle your forehead up. Good, okay. Then frown. And then smile. Okay, and everything looks symmetrical when he does that. Then show me your teeth. Okay, and no, that's okay. And then purse your lips like you're going to blow. And then stick your tongue out to the side and push against my hand with a little bit of resistance. Okay, everything looks good there. Then 8 is hearing. We've already covered that in our eyes, ears, nose, and throat. The glossopharyngeal was somewhat partially taste, and we've covered that in some of the others also. There's also the vagus, which is gag reflex. We did that in another one. Spinal accessory is to evaluate size and shape of the trapezius, which we would be covering too in our musculoskeletal. And then hypoglossal is the tongue, so if you'll stick your tongue straight out and then in, just do out and in, out and in, okay? And then curl it up and curl it down, okay? And then side to side, okay? And then push against the cheek again, which I did on the other one, but really fits in this one. Okay. Then we're going to do gross movement. You may not be able to see all this on the camera, but what I'm going to do is have him step down off the stretcher. I'm going to have him walk across the floor, which actually he did as he came in, just walk normal. I'm going to evaluate his gait, his balance, his movement, and then that looks fine. Everything looks okay. Then I'm going to have him turn around and walk heel to toe that way. That's to check his coordination, balance. Okay, and then back. Then we're going to do the a Romberg test, which is kind of like a sobriety test. If you'll hold your hands out to the side, your arms out to the side, put your feet together, and close your eyes, and just try and stand still and see how your balance is. Okay, and that's good. And then hop on one foot for a second. Okay, that's good. That all, you can sit down now. That all checks gross movement, and everything seemed to be okay with that. Then we're going to do fine movement. First thing I want you to do is take your palms and have them up and then down, and do this as fast as you can. Okay, if you can do that, good. Then I want him to touch his thumbs to his fingertips, back and forth. Just walk them back and forth, and that's fine. Then take your, he said he would have a problem with this because of his legs. We're going to try it. He just has a little bit of arthritis right now that's causing some pain. But if you'll take your toe and try to run it down this shin, just move it over there and run it down that shin. There you go. He did it. Okay, we do that on both sides to evaluate also more of the fine motor movements. Then sensory. And for that, it's kind of like the test we did earlier. We've already tested him for sharp, soft, sharp and dull. We did that, but we also want to test for discrimination, to be able to tell if he can tell if we're using one or two sharp objects when we touch him anywhere. So if you close your eyes, okay, tell me if this is one or two.
One.
Okay, and then tell me if this is one or two.
One.
Okay.
Two.
Yeah. And we would do that in different areas over, especially if we thought there were any areas that had any sensitivity problems. If he was diabetic, probably on his face too, because he's a little bit older, might have problems there with that. And then that test, the other thing we can do is use the palm of his hand and do graphesio, which is close your eyes, and I'm going to draw a number in your palm and tell me what it is.
8.
Okay. And let me do a number.
3.
Yeah, 3. And then the other thing we could do with his eyes still closed is to test stereogynous stereognosis is hand him some objects and see if he can tell what the objects are. Okay, can you tell me what that is?
Ink pen.
Okay, and can you tell me what this is?
Might just be a cell phone.
Yeah. And what about this?
Tongue depressor.
Okay, good. Then we're going to test reflexes on him, and hopefully we can get these okay. The first one I want to do is the biceps. We're going to put his arm kind of at a 45-degree angle. I'm going to put my thumb over the biceps tendon. Going to let his arm hang loose. And that was good. The next one we want to do is brachioradialis, and it's more or less on the forearm. And with that one, I'm gonna let his arm just rest on mine. Ooh, good. Okay. And then triceps, which is the back of his upper arm. Arm should come out there. There it did. Okay. Yeah, I just didn't see it. Then the patellar. His knee, we can do that without raising his. Just relax your knee on me. I'm going to feel for the little notch there, and had a very good reflex. And then the Achilles, his heel. Just relax your leg there. Did it do it? Yeah, there it is. Okay. And I don't know if you could see that or not, but I was doing in the back of his heel. And then the other thing I want to do is the test for a Babinski sign, which is letting him taking the bottom of his feet, which you can't see on there. Okay. And doing that to see if it's, yeah. And he has a good one. That's what it should do. Now we're through. That's all of the neurological, other than the things that we've already covered in our written paper, which was doing a orientation, making sure he was oriented, knew where he was at, his speech was appropriate, and the things that we do in a normal neurological assessment, squeezing hands and legs, but we can cover all that in the musculoskeletal also. We're going to move on to the musculoskeletal, and of course inspecting is the first thing, and we've already done a lot of that. As he was walking, I was inspecting his posture, his weight balance, his gait, the way he handles himself, the way his feet were in position. Then I want to do his TMJ area again. Open your mouth for me, which we kind of did when we did the cranial nerves earlier. Anything tender there? Okay, just feel into that joint there to make sure there's no masses, no clicking movements when he closes and opens. Then if you'll stand down here, I'll tell you what, turn around this way. I want to pull his shirt up, and I want to inspect his spine, the paravertebral muscles, and I'm just going to go down through there and feel from the cervical to the thoracic area, down to the lumbar area, just making sure everything's in alignment, feels structurally sound, and it does. Then I want to test his movement or his range of motion of the spine. So if you will just bend forward like you were going to touch your toes, okay, and then raise up and come backward a little bit, like, okay. Then move to the right, and then to the left, and then kind of swing all the way around like like this way. Which is kind of hard to do, but anyway, that shows he's got good range of motion. Okay, and now you can sit back up there. Okay, now we're going to do some joints. Sounds good, don't it? And as he's doing all these, I'm going to palpate as he does them to see if there's any clicking or tenderness or anything like that. Are we going to be able to do it this way, maybe? I'm going to try this side. Okay, first we're going to do shoulder. And we want to do forward flexion of your shoulders. So if you just kind of bring this arm up across your chest, flex it forward, and then flex backward. Good. And we're going to do these on both sides. You could do them both at once or one at a time, either one. That's forward flexion, backward flexion. We want to do abduction and adduction. Abduction is raising your arms out, and adduction is down and actually across this way. There you go. Across each side. We touch each side that way also. Shrug your shoulders up. Okay, let me shrug up up against resistance to make sure they're good and equal, and they are. I also want to test for strength in triceps area, so if you want to just push against my hand a little bit, up this way. Good. And then we do it in the other hand, the same thing, push up. And then the same thing on biceps, if you'll push forward. Okay. Okay, and now put your arms up this way and push against my hand. Good. Okay, and that all seems to be normal. Then we're going to do elbows. I want you to flex your elbows out straight and then extend it up. Good, and I'm feeling, as we do for any warmth, tenderness, clicking, edema. And then do them, just kind of do them up this way. Yeah, there you go, and down the other way. Good, okay. The other thing I didn't have you do is to do the scratch test. Put your hands behind your neck like you were going to scratch your neck. Okay? And then behind your back. There. Good, okay. I had forgotten that one. Then I want to hold your arms out with your palms up, arms straight out with your palms up, and then with your palms down. Good, okay? Now we're going to move on to wrist. So for your wrist, I want you to flex it down, and then up, and then to your left side, and to your right side for deviation, flexion, and extension. And then fingers. Okay, flex your fingers out, or extend them out, then flex them down, bend them, then pull them apart, which is abduction, and then together for adduction. And then I test grip strength at this time too in both hands. Okay, and it's good and equal. And that does I think we've got our upper extremities covered. Now you can lay back down, and we're going to do lower extremities. Okay, and the first thing we want to do is hip. And of course I would inspect and feel if we had him disrobed and in the right area. And we want to do internal and external rotation. So if you'll bring your leg up this way and rotate your leg in and then out. Good. That's internal and external rotation, and that looks good. We do that on both sides. And then we're going to flex your knee up, kind of up in the air a little, just to make sure the hip movement's okay, and then extend it out. Okay, and if you could roll over on your stomach, it's really the only way we can test extension of the hip. Lay straight. I may have to let your head down a little, and raise this leg up a little. Straight. There you go. Okay, that's good. You can roll back over now. I probably should have had his head down flat to do that well, to show the extension well. Then your knee, we're going to flex and extend, which we sort of already did. You'll hold it up in the air and flex it, and then just extend it straight out up in the air. Okay. And we would do the other one the same way. And for ankles, we're going to do dorsiflexion, which is pushing up against my hand. I know you can't see that. Having trouble getting it in the camera, but here, I'll try to do this. There you go. Okay, push up against my hand, and then push down. That's plantar flexion. Both of those seem to be good and strong. And then do your leg, rotate it in, and then out. Okay, and we test that on both sides. And then the same thing with the toes. If you would flex them down, your toes, and then extend them up. Okay, good. And kind of try to separate them a little. Okay, good. That all seems to be fine. And I think that pretty much covers our abdomen, our neuromuscular, and musculoskeletal in most of the areas, other than we would have done it bilaterally on everything and tested the strength a little bit more thoroughly of each extremity. And then when I was doing the joint palpation and everything, I would have palpated a little bit better for tenderness or warmth or edema while he was moving them, and took a little more time to have him move them. And I think that's it, and the rest of it should be in my write-up in my paper. Thank you.